describe intellectual disabilities and learning disorders?
Okay, I will separate them because they're a little bit different and there is some overlap. Intellectual disabilities are with people with those have problems both with intellectual functioning and the ability to function with their daily activities. So the former term was mental retardation. And now we don't use that phrase, mental retardation. We use intellectual disabilities. So they have sometimes difficulty with speaking and reading, even eating, or using simple tools such as a telephone, caring for themselves, and interacting with others. These are all affected when somebody is born with intellectual disabilities. Intellectual disabilities can also occur after severe brain damage as well. That's irreversible. Learning disorders. In learning disorders, it's possible to have the normal level of intelligence, but they have some difficulties in the nervous system that affects receiving, processing, and communicating information. And usually they're noticed when the child first starts to attend school. And that's why we call them learning disorders, because starting in school, they start to learn concepts. They start to learn how to read or learn how to do math. So those are the differences between the two.
What do you think causes them?
Yes, for both, genetics plays a large role. Illnesses can also play a role or begin some of these learning problems, and injuries that causes brain damage. For learning disorder, not that it causes it, but it could be worsened if they have another disorder such as attention deficit hyperactivity disorder, because attentional disorders can make it worse for the child to not learn very easily. So those are some examples.
What are typical treatments?
So I'll start off with intellectual disabilities. First, an evaluation is definitely needed to know the underlying cause, because intellectual disability is a big general term, but there are different reasons causing that. So a full evaluation sometimes is needed by an entire team of professionals, neurologists, psychologists, psychiatrists, special education specialists, also by hearing, speech, vision checks, even physical therapy. They all have their tools to try to discover whether it's due to a genetic problem or a significant just only a learning issue, and if there's a psychiatric issue. There are certain intellectual disabilities that are caused by medical problems, and so a pediatrician or a physician is also needed to figure that out. Hearing, I mentioned that earlier, needs to be checked because sometimes even when they were a toddler or older, the parent didn't know that they were not hearing very well. And so they would have a speech delay because they couldn't hear very well. Oftentimes, with intellectual disabilities, they experience emotional and behavioral disorders as well because they become so frustrated or anxious or depressed because they can't express or communicate what they need. There could be eating and sleeping changes. Sometimes they are victims of bullies and they get bullied because they're not behaving like the other peers. So we have to be looking out for those. Now, the typical treatments for learning disorders is also an evaluation because sometimes there needs to be an additional educational testing in order to confirm what kind of learning disorder they have. And sometimes after that confirmation, to help parents and caregivers realize what the proper school setting should be. A traditional school may not be sufficient, and the child might not be able to keep up. And also, if special ed is needed or speech services. And lastly, like I mentioned, if there is a disorder confirmed such as ADHD, it is so easily treatable to help somebody overcome some of the learning struggles. I remember having one client who didn't get treated for ADHD, and I discovered it, and he had very, very serious issues of advancing in his reading. It was very slow for his grade level. But after the ADHD was treated, he was able to stick to the page and read, and he was able to learn and catch up.
Can children with this disability experience drastic improvement with treatment?
Well, the word drastic, I'm not sure exactly what you mean by drastic, but I will say that maybe we cannot extinguish the original problem. We can't necessarily greatly improve someone's IQ, intellectual quotient, but we can prevent poor progress, because if we don't intervene with some teaching and some training, sometimes a child can be left to their current level of disability and just remain there. I think the human brain, there's always some possibility to learn more and train more. Maybe not to the level of other peers and their greatest potential, but we should try to figure out each individual person's greatest potential. And if we don't do that, there is a long range consequence, and we can try to lessen that with early intervention. I met a friend who told me that his younger brother had severe intellectual disability, and his parents told the parents that his brother will never change and he's never going to amount to anything, and this is how he's going to be for the rest of his life. And so unfortunately, the parents did not learn from those medical specialists that they could have really trained that child. So my friend, the older brother, realized one day everyone was tying his shoelaces for him all the time. And one time they secretly caught him tying his own shoelaces. I guess he did learn somehow, but the family was assuming he doesn't know how to tie his shoelaces. And so my friend one day was laughing because the younger brother just stuck out his shoe and waiting for someone else to tie his shoelaces when he already actually knows how to tie them. That means he had that learning capability for at least simple tasks such as that. So in learning disorder, for example, if they have a math learning problem, we need to help that right away. There is a possibility to slowly develop those skills, because if that doesn't occur, they will never be able to go to the next level of math, such as algebra. And whatever their level of capability, we need to help them reach that without pushing and pressuring, but to discover how far they can go with their reading and writing and speech, because all of those things, it can improve. And lastly, also, independent skills. Independent skills is very important. I find a lot of families, they feel that once they're depending on the caregiver, they will always have to do that. And so the caregivers live in fear and anxiety. What is my child going to do when they're older and I'm not around? Who's going to take care of him or her? But all along the way, they could have taught a few things. How to spread peanut butter and jelly and how to make a sandwich, or how to hold a milk bottle and how to pour it, or even a little bit of sign language if they can't say with their words of their needs. So these are a few examples of how we can teach some independent skills.
What can parents or teachers do to help the children with these disabilities?
Yes, I have a lot of thoughts on this topic. One is really to show them that they have value and worth. Many of them already feel they have emotions and they have opinions about themselves. They can see their peers and others do things and think about things quicker, and they can tell that there's a difference, that they are slower than others. So we need to have them understand that their value is not based on their IQ and not based on their academic achievement, that they have a different special plan from God. Also, we also need to avoid shame, guilt, and comparison. There might be one sibling with intellectual disability or learning disorder, but the other sibling is highly capable. And we need to help each child feel how they are special in their own way and not to do that comparison. Next, I was thinking of is to have appropriate academic and life goals. There are some certain parents, and understandably, have a hard time accepting that this is possibly a permanent situation, and that their potential is not bringing up that IQ all the way to above average. So acceptance is necessary, but of course not to give up on the child either. So what I'm trying to say is there are certain parents who pray for a miracle and then some way that they can pull out of this intellectual disability and then become a surgeon themselves. I've heard of this before, and I don't think that's fair, right? If there is somebody who literally lost their leg and then they have to walk with a cane, walk with crutches, or be on a wheelchair, you can't look at that patient and say, one day you're going to win the Olympics for the marathon, or you will win that. That's not fair, right? So same way with intellectual disabilities, they themselves know that they have this issue, but we need to help them figure out what they might like to do and what their skills and assets are. Next one is to definitely address all of their needs. If they can't do it for themselves, nutritionally, medically, emotionally, and also to communicate with them according to their ability. With intellectual disabilities, there's various levels of severity. And for someone who has moderate to severe levels, we need to speak at the speed and with vocabulary that they would understand. And next is to help increase their self-confidence, to give them that affirmation when they are doing well, and to help them discover their strengths. Even though they may not fully understand these concepts, we can help them realize that they're good at something. For example, clapping and saying yay when we know that they're really good at something. Some children, you would be surprised that they are good at jewelry making, for example, or they're good at baking. You'd be surprised. They may not be able to write a book or be a professor at college, but they may be good with their hands. Also, in certain larger cities, there are available social and professional services. Seek after those things. special schools, educational therapists, psychology, psychiatry, and in certain major cities, most major cities, I think, in the US, there is a center called Regional Center, and it is a specialized service for those who have been diagnosed with intellectual disabilities. We also can help family members, other family members, to understand and cope with the realities and the difficulties of this, and to have empathy for them and to help them out here and there. Sometimes if you can be a mentor to the child and to give a couple hours break for the parents, sometimes that could be very helpful, and it also gives socialization time for the client or patient. And lastly, definitely, as parents, teachers, and caregivers, older brothers, mentors, we should continue to preach and infuse the good news, right? To give that message of Christ's love and grace and bring that spiritual understanding, even though you may think they may not understand. That is not completely dependent on the IQ of the person. So I have two examples. I have two friends. One has a brother with a severe intellectual disability that was caused by a medical accident. And I have a friend who has a daughter with a genetic problem, and she's not of the highest IQ either. But the gospel was preached to them, and the message of Christ's love was shared, also with their actions as well. Taking them to places where the gospel can be heard and worship can take place. And over time, even though they cannot express like the whole gospel message, you can tell in their heart that they believe. So this is something very important to understand. They may not be able to learn math and geometry and calculus, but you can tell them about Jesus, and they can learn that, and they can experience that love, even though they may not be able to express that they do. But one evidence I know that they are experiencing God's love is my friend's brother. He enjoys going to worship. And my friend's daughter, her favorite song is Jesus Loves Me, and can't wait to go to Sunday school every Sunday. So these are some evidences that infusing the gospel message is not reliant on the IQ.